Artificial Intelligence Dr. www.abcpharma.net/English. What are the physiological indicators that suggest successful implantation and functionality of an Aveir VR leadless pacemaker? Claude AI answer. The physiological indicators that suggest successful implantation and functionality of an Aveir VR leadless pacemaker encompass several parameters and observations. Here's a comprehensive overview. 1. Electrical parameters. A. Pacing threshold. Typically less than 1.0 volts at 0.4 milliseconds pulse width. Stable or decreasing over time. B. Sensing, R wave amplitude. Generally greater than 5 mV. Consistent and stable readings. C. Impedance. Usually between 400–1000 ohms. Stable measurements over time. 2. ECG characteristics. A. QRS morphology. Relatively narrow QRS complex. Typically less than 140,150 milliseconds. Often shows an RBBB-like pattern in V1. Earlier precordial transition compared to RV apical pacing. B. Pacing capture. Consistent capture on ECG at programmed output. Absence of fusion beats at higher pacing rates. 3. Hemodynamic response. A. Blood pressure. Stable or improved blood pressure with pacing. Absence of significant drops in systolic pressure during pacing. B. Cardiac output. Maintained or improved cardiac output can be assessed via echocardiography. 4. Echocardiographic findings. A. Lead position. Visualized in the right ventricular septum. Absence of perforation or pericardial effusion. B. Ventricular synchrony. Improved or maintained interventricular and intraventricular synchrony. Absence of significant dysynchrony on tissue Doppler imaging. 5. Patient symptoms. A. Resolution of pre-implant symptoms, e.g., dizziness, syncope. B. Absence of new symptoms like diaphragmatic stimulation or chest discomfort. 6. Device telemetry. A. Appropriate rate response to activity, if rate responsive mode is enabled. B. Correct sensing of atrial activity, in VDD mode, if applicable. C. Expected battery longevity based on current drain. 7. Radiographic findings. A. Stable device position on chest X-ray. B. Appropriate orientation within the right ventricle. 8. Long-term indicators. A. Stable or improving left ventricular ejection fraction. B. Absence of pacing-induced cardiomyopathy. C. Minimal percentage of ventricular ectopy. 9. Biomarkers. A. Stable or decreasing levels of NT-proBNP over time. B. Absence of significant elevation in cardiac troponins post-implantation. 10. Exercise capacity. A. Improved or maintained exercise tolerance. B. Appropriate heart rate response during exercise testing. It's important to note that these indicators should be assessed both immediately after implantation and during follow-up visits. The trend of these parameters over time is often more informative than single measurements. Additionally, the specific targets may vary based on individual patient characteristics and the reason for pacemaker implantation. Successful implantation and functionality are typically indicated by a combination of these factors, rather than any single parameter. Regular monitoring and comparison to baseline values are crucial for ensuring optimal device function and patient outcomes. Would you like me to elaborate on any specific aspect of these physiological indicators or discuss how they might be used in clinical decision-making?